and Aging Committee, Wednesday, October 30th, 2019. Can we have a roll call, please?
Calling the roll, Ms. Conwell.
Here.
Mr. Jones. Mr. Jones is absent at the moment. Ms. Brown.
Here.
Mr. Miller.
Here.
Ms. Stevens. Ms. Stevens is absent at the moment. We have a quorum.
Thank you. Is there anyone signed in for public comment?
Yes, Madam Chair, we have 2 people signed in. Mr. Brian Mallory.
Good afternoon. Thank you, Madam Chair, distinguished council people. I'm here to talk about the opioid settlement that the county just entered into. I was reading in the press that Summit County, which also was party to that suit, has enlisted a citizen advisory group to provide recommendations to how that county would allocate those resources. It is my fervent wish that our county follows suit. There are plenty of neighborhood and smaller agencies in this county that have been doing a lot of good work in this area that may not have access to those funds and might have some very good ideas of how best to allocate those resources. And it is my wish that that would be something that the council would consider to distribute those funds. Okay? Thank you for your time.
Thank you.
Ms. Lou.
Madam Clerk, do you have his contact information?
Yes.
Okay.
Good afternoon.
Good afternoon.
Good afternoon.
Here today we will have a presentation from the Board of Developmental Disabilities. In the past, I was very supportive to this particular entity of the government, just like Adams Board, because I know they can help lots of residents in our counties. However, throughout the time, even in the shelter, at the maximum time I have seen, we could have maybe 3-4 people autistic and some other people with different kinds of developmental disabilities in the shelter or at the same time. So you can imagine how chaotic that would be, especially when these people cannot really comprehend shelter environment. Lots of them actually got unfairly discharged during the night. Some of them did not even know the area as well. For them to go from downtown area, which they are not already unfamiliar, to go to another unfamiliar area, which is Seasonal Hope is located, this has been really not a good situation. However, every time when I make the effort, try to get these people with some help from this particular entity, the situation is the budget cut has been on for not just this year, it has been for a while. And this particular entity's funding has been cut. And also due to the state federal rules and regulation, they have to change their roles a little bit or too much. So now, even people coming here today, they have all the hearts to help people, but the people at their front desk actually will refuse these people to assess them. Because once they are assessed, being qualified, the board has to support them whole their life. And they know the board cannot afford it. So we really need to find a solution on this. Keep cutting their budget, Board of Developmental Disability, is definitely not a good solution. Because right now, younger kids in school, they will be able to find out they're autistic or having some other issues. But for the people already at a certain ages, they couldn't get diagnosis when they were younger as a kid. So now they are having a hard time to struggle with the people who completely don't understand them. And this is really bad and too cruel. And that's why I mentioned in the past, how about we just move the whole shelter into county jail? At least if somebody dies, we will know. And this is really wrongful treatment, abuse, mistreatment, whatever, all these words you can think of. This is completely wrong for all these people got into homelessness and without help. Thank you very much.
Thank you. Anyone else signed in for public comment?
No, Madam Chair, that was the final speaker.
All right, can I have approval, motion to approve the minutes from the October 16th meeting?
So moved.
Moved and seconded, all in favor say aye.
Aye.
Minutes have been approved. There's no matters referred to the committee today. Today we have a presentation and from the Board of Developmental Disabilities, Cuyahoga County, and thank you for waiting on us to get here. We're all in budget meetings and doing various things.
No problem. Good afternoon. I'm Kelli Petty, Superintendent and CEO of the Cuyahoga County Board of Developmental Disabilities. Thank you to Councilwoman Conwell and members of the Health, Human Services, and Aging Committee for an opportunity to present updates from the Board of Developmental Disabilities to you this afternoon. 2019 has been a very busy year. We've succeeded in meeting or making significant progress on all of our goals. As you know, much of 2019 has been focused on plans to privatize our direct services. We are now, as of the end of August, the Board of DD no longer provides transportation services. That's being done exclusively by private transportation companies. Back in January, we published a competitive request for qualifications. And then in July, our board approved 2 very worthy DD providers to take on the operations of our 8 adult activity center, and that will be effective on January 6th of 2020. So the entity called SAW Incorporated will be taking on our Beechwood, East Cleveland, Euclid, Maple Heights, Parma, and Rocky River centers, and Vocational Guidance Services, or VGS, will be taking on operations at our Brooklyn and Southwest adult activity centers. Now we are preparing all necessary details for this transition. We have assured families impacted by this change that the transition will be as smooth and seamless as possible, and we're working hard to see this through. Some other updates since last time at this year same time last year when I presented to you. As a result of our privatization, we anticipate reducing our staff by approximately 375 people. Unfortunately, the privatization it results in a loss of staff. We also sold our Forest Hill Center that is located in East Cleveland to the McGregor Pace Company. We are still in the process of selling and transitioning what's called our intermediate care facilities. These are community-based group homes that have been actually operated under a management contract by private providers for many years, some of them as many as 30 years now. And we are in process of transitioning those homes over to those private providers. We continue to provide what we call safety net services. So even though we are privatizing and we largely use Medicaid funding, we do know that there are times when an individual cannot access Medicaid funding for some reason, or their needs are so great that they're unable to identify a private provider who's willing to support them at those Medicaid rates. And so we continue to locally fund what we call safety net services for those individuals. And then we have expanded our family supports program. Our family supports program is a very family-friendly, flexible source of funding for individuals that reside in their family homes. They can access up to $1,500 annually. And so we've expanded this to allow more people to be eligible for that and also to include more types of services. And then also I'm proud to share that we developed what we're calling a custom living environment, or CLE. This is a demonstration smart apartment that we have located in our William Pat Day Center in Cleveland. And it's a place that individuals with developmental disabilities, their families, professionals, and anyone is welcome. But people can come in and see varying types of technology, assistive technology, all the way from very low-tech items that are literally off the shelf that people could buy at any store to some very high-tech options. And we just wanted to create this so that people could come and start to have an idea of how they might be able to use technology to gain skills and independence. And at the same time, we also created what we're calling the assistive technology vehicle. We had a vehicle that we were no longer using, and so we outfitted it to be kind of a mini version of the smart apartment. And for people who might be unable to come downtown to see the smart apartment, we can actually take this vehicle out to them and give them a sampling of some of the same kinds of devices. Back on September 1st of 2018, the State Department of Developmental Disabilities enacted significant changes to the waiver waiting list rule. To date, these changes have had a significant impact here in Cuyahoga County, and a positive one. The rule includes a new standard statewide assessment tool, and only people who are identified as having a current unmet need are now placed on the waiver waiting list. Previously, it had been on a first-come, first-served basis. So you can see on the slide, back when this new rule went into effect, September 2018, there were 2,329 individuals on our waiver waiting list just in Cuyahoga County alone. Since that time, we have completed about 1,400 of these assessments that I mentioned, and another close to 700 people were removed from the list due to factors such as living out of the county. They may have been deceased. They may have been living in a facility that, like a nursing facility, and could not be enrolled on a waiver anyway, or they actually were enrolled in a waiver. And so those people were also removed. So as of now, your slide says we have 181 of these assessments left to complete, but it's actually fewer than that since we created this graph. There's actually only 60 as of today. And we currently have 0 people on our waiver waiting list, which is a tremendous accomplishment. And then for the long term, or longer term, we believe this new rule and our stable financial position will allow us to maintain only a minimal waiting list or even a 0 waiting list for the foreseeable future. So we're very excited about that development. Just to show the need for our services does continue to grow. We project that our enrollment at the end of this year will be about 9,800 individuals, and our estimate for next year is about 9,950 people. The waiver enrollment numbers are that at the end of this year there will be about 4,450 individuals enrolled in a Medicaid waiver. And next year, that number will be just over 4,600 by the end of the year. So about 50% of the individuals enrolled with us are also enrolled on a Medicaid waiver, and we expect that that number will continue to grow over time. This graph just shows our levy funding for the last 5 years or so. We are estimating $106 million in levy revenue this year and also for next year. This is a slight uptick over recent years, but our levy does date back to 2005. It's a 3.9 mil continuing levy that was passed in the fall of 2005. However, our overall revenue is anticipated to sharply decline next year. This is due to three main reasons. One is that discontinuation of the direct services that I mentioned. Because of that transition, we're also going to lose the staffing associated with it, so that expense, but we also lose the associated Medicaid revenue that comes with being a direct service provider. We are, as a function of selling and transitioning those ICF homes, we stand to lose about $24 million in revenue due to that. That was primarily just passed through our budget to private providers. And then we also typically would receive one cost report settlement each year from the Ohio Department of Developmental Disabilities, but next year we are not anticipating any cost report settlement, so that's another significant reason for the big loss in revenue next year. This slide just depicts what our Medicaid waiver match expense has been over the last 5 years. The percentage of our levy funds that we use to fund Medicaid services has remained in the low 40% or so for the last 5 years. There is some fluctuation with that mainly has to do with how much participation the state of Ohio has with its budget. However, despite this, we have been able to dramatically increase the number of people enrolled on Medicaid waivers. So pertaining to as a percentage of our budget, we anticipate next year, 2020, we will spend close to $46 million on Medicaid waiver match, which is about 43% of our overall expenses. And just to show how the Medicaid waiver match works, Medicaid is a partnership between the federal government and local governments. And so this slide shows that in Ohio, the federal government pays about 60 cents on the dollar. The local government pays the other 40 cents. That number is put together to equal 100% payment that is made to the service provider. So they receive 100% of the established rate. Where that 40% county is on the pie chart, some of what makes that up is actually state money. They do participate in providing part of that local share of the Medicaid funding. However, the vast majority of local match for people with developmental disabilities and developmental disabilities waivers is paid for using Ohio County Boards of DD local levy dollars. The overall impact of the Medicaid waiver match here in Cuyahoga County is that we take that $46 million or so, and in turn that provides about $185 million worth of services to those 4,600 or so individuals that are enrolled on the Medicaid waivers. So that money goes to over 200 local agencies, private agencies, who in turn provide jobs to thousands of individuals in this community, people who are also homeowners and purchasing local goods and services, and help to fund the county's overall safety net. So we think that this has a much bigger economic impact than just the $46 million that we use our levy funds for. So turning to our future, we are just about to roll out our next 3-year strategic plan. Our board has not yet approved it. We expect that to happen in December, but these are goals that they are in agreement with. Our 4 strategic plan goals going forward are that people have access to needed support, people receive person-centered quality supports, people are supported with innovative solutions and options, and that people recognize and value the Board of Developmental Disabilities. So related to this, a lot of people ask me, what are we going to look like in the future now that we're not going to be a service provider anymore? What is the role of the Board of DD? And we have lots of roles and functions currently that we do and we will continue to do. And that includes providing support administration. We call it support administration. You can think of it as case management. So we provide case management services to all 4,600 of those people that are enrolled on a waiver, plus an additional 700 or several hundred people who may need that kind of service. We also provide specialized services currently, like early intervention services. We serve about 2,400 children between birth and age 3 every year in our early intervention program. We provide school age services through consultation with the different school districts. We provide behavioral intervention services for them, or therapy and assistive technology services to those school districts. We also have a fairly large behavioral health services department that can get involved with people who are experiencing different kinds of behavioral challenges. that would perhaps get in their way of being able to participate in their community. We have a behavioral health department that helps with that. We provide therapies for both children and adults, and as I mentioned already, assistive technology. We also promote high quality and services and supports with that provider community. Again, we're talking about having over 200 local provider agencies that are actually delivering services and supports to people with disabilities. And so we have a small department of people that coordinates efforts to support them in that task, either by identifying gaps and attempting to strengthen our provider community or bring in different providers who might know how to serve certain types of people. We provide a lot of training and a lot of technical support to the provider community so that they are in the best position possible to deliver high quality services. We monitor services through that support administration function. We investigate abuse and neglect and other situations in a department. We have a department of investigators that do that and work closely with law enforcement when necessary. And then again, we assure the provision of those safety net services. So even if someone is enrolled on a Medicaid waiver, if for some reason they're having a difficult time identifying a service provider, we have a contract with various local providers that we can use local funds to make sure they receive the necessary services and supports that they need. And then also, again, we are in a very stable financial situation, and that is going to allow us to focus more of our financial resources directly to people that are eligible for services. So again, we intend to maintain a minimal or potentially no waiver waiting list, because we've been able last year, and next year we will be expanding the number of new people that are enrolled in a Medicaid waiver. We're able to direct more financial resources to that. And then we also are expanding that family supports program. So that actually went into effect on October 1st, but once people learn of it and start to take advantage of it, what will end up happening is virtually everyone who is eligible for Board of DD services will either have access to a Medicaid waiver or access to this family supports program. So virtually everyone will have access to some support, and we're very excited about that, that our financial situation is allowing us to do that. We also can invest in some improvements to simplify our processes and increase efficiency, invest in technology, indefinitely postpone the need for additional levy funding. We don't foresee that being a need for us at all in the foreseeable future. And then also we need a little bit of time to adjust to our new role. We're going to be a very different looking agency in January. As I said, we're reducing our staffing by over 350 people, and we're no longer going to be involved in a very significant part of what we have historically done. And so we expect to take a little bit of time next year to just figure out where do we need potentially some additional resources, and what do we look like going forward for the long haul. And then last, I've shared this same slide before, but we do believe we are a vital part of the county's overall health and human services system. We participate regularly with our fellow county agencies and participate when we have individuals that are eligible for multiple systems. And so that's a big part of who we are going forward. So I know I went through that very quickly, but I would be happy to answer any questions or cover anything that that maybe you were hoping I would address that I did not.
Councilwoman Brown?
Thank you, Madam Chair, and thank you, Ms. Petty. My apologies for my tardiness earlier today. I did want to emphasize the state mandated, the privatization is state mandated.
It comes from a federal mandate
okay.
related to Medicaid, yes.
Okay. And you identified the transportation where you sent out the RFQ. Does this cover all of the facilities?
Yes, so with transportation, we did not do an RFQ. By the time we realized we had to completely phase out of that role, we were well on our way towards moving a lot of transportation to private companies anyway. So that just happened over time. But we did put the RFQ out in January. Yes, that was for all 8 of our adult activity centers. And so we were, it was very important to us to maintain all 8 of those centers. We feel like those centers are good, safe, well-maintained places that were designed to support people with developmental disabilities, and it was important to us to see them continue to be used for that purpose, but also just for a consistency and continuity factor for the individuals. At least they would be able to continue to attend the same center.
Okay. You also mentioned that the reduction of the staff is going to be approximately 375. Is the state making any efforts, or will these individuals just be displaced workers at this time?
Well, again, it was important to
Or
us
federal.
to build in consistency. So we actually created an incentive for them to go and work for the private organizations that are taking on those 8 centers. So the entity SAW Incorporated is one of those, and Vocational Guidance, they have actually interviewed and plan to hire many of our existing staff. And again, it was important to us that that happened so that the individuals attending those centers still see some familiar faces, and it's not, a complete change for them. But also, these are good, well-trained staff, and a lot of them. And there is a real shortage of direct service professionals in the field. And so we hated to lose all those people to the field. And so we created an incentive to get them to stay. We believe it's working. We don't 100% have all those numbers yet, but we believe it's going to work pretty well.
That's good. I know you and I had talked about that before, keeping some of the workers in place so to ensure a smoother transition. I also wanted to touch on the expansion of the family supports program. You said there will be eligible for $1,500 per year, and you will increase the access for eligibility and service. Can you tell us how?
Sure. So family supports, the maximum a family could receive, or the individual still has to live at home with their family, and they can access up to $1,500. In the past, we applied an income standard, so oftentimes people ended up not being able to receive anything because their income was deemed to be too high. And so what we've done is we've said anybody age 18 and over who lives with their family can access the full $1,500, no questions asked. They don't have to demonstrate any of their income, just recognizing an 18-year-old is an adult and that they can access it. And then people who are under 18, they would fall into just one of 2 categories. They can either access the full $1,500, or if their income is over a certain amount, they would only access half of that, or $750.
That $1,500 is on an annual basis?
Yes, January to December.
Okay. The other question I had was with regards to the investigators of the abuse and neglect that you intend to keep within your future plans. How many investigators do you currently have?
There are 14.
14. And those are the ones that are used to investigate any calls that you might receive, like from a hotline or something?
Yes, we have a hotline 24 hours a day, 7 days a week. And there are other categories of things that get investigated. So even if someone is hospitalized unexpectedly, but it's not suspicious or there's no abuse or neglect, we actually have to conduct an investigation and file a report with the state on that.
And then the $46 million that you said we've leveraged to $185 million. Can you just clarify that for me? So you no longer get the $46 million?
So what we do, we get the $46 million through our levy collection, but then we send that down to the State Department of Developmental Disabilities. So all county boards in Ohio have some amount that they send down there. And then DODD the Ohio Department of Developmental Disabilities keeps that. The federal share comes in to them also. The provider bills the State Department of Developmental Disabilities and receives their payment from them.
Okay, and I apologize because I wasn't here for the first day of budgets, which may have been when you presented this. No?
No, I did not present. Maggie Keenan included our budget as part of her presentation, yes.
Okay, and my last question, thank you, Madam Chair. I had quite a few. This is always a subject that is near and dear to me. So we talked about I think you mentioned 200 entities that the local agencies,
Yes.
those, will they now receive the money directly since you guys are no longer providing those services?
Well, they always did.
Okay.
So the services that we provided, we were just like one other agency that was able to provide those services. But there has always been a large number of private providers providing Medicaid waiver services. We were a very large provider, and we will no longer kind of be in that mix. But those 8 centers of ours where we were the direct service provider it was just one piece of it. So, for example, all residential services have always been provided by private provider agencies using this same formula. And part of that $46 million goes towards that. In fact, that's probably even a lot more of it than we were just a day services provider.
Okay, and then I promise this is the last question. The 24 million pass through, does that now go directly to, you were once a pass through you identified yourself as a pass through for $24 million. So does
that will
now
go directly to those providers.
Okay,
yes.
Thank you, Madam Chair.
That's for a different type of facility. It's called an intermediate care facility.
The ICFs.
ICF it's funded more kind of like a nursing home. It's not a Medicaid waiver. It's a different Medicaid program.
ICF
Stands for Intermediate Care Facility, and so the funding system is most similar to a nursing home. It's not exact, but if you think about it in that way, it's more like a nursing home and not like a Medicaid waiver.
Okay, Councilman Miller.
So, Director, since you're not anymore able to provide direct services,
Yes.
how are the safety net services provided?
Those are provided through a contract with mostly the same service providers. So, for instance, occasionally someone just cannot be enrolled in a Medicaid waiver, or there's an urgent need for services and it takes time to get them enrolled. So we might implement the safety net services to allow them to start to receive services right away. And so we have a contract directly with that provider agency to pay them locally. And then once the waiver enrollment kicks in, then they bill the waiver instead. Or some people might have they have very high challenging behavioral needs or medical needs, for example, and they need one-on-one staffing. They need very close staffing. The Medicaid rate does not cover that, and so providers won't agree to it because they don't get paid enough to cover that. So we would assess that situation and could use the safety net for that. Those are examples.
Madam Chair, Director, if a person receives a Medicaid waiver, what exactly is it that's being waived?
The Medicaid waives certain requirements, mostly income requirements. So if a person especially if you think of a child under the age of 18, if they live with their family and they just go to apply for Medicaid at the local office, they will look at mom and dad's income, and the child most likely, if mom and dad are working, the child most likely would not be eligible for Medicaid because the parent income is too high. But with a Medicaid waiver, that income is waived and the person is just looked at as an individual household. And then there's also a higher income standard even for adults under the waiver. So most people with developmental disabilities end up being eligible for a Medicaid waiver. Occasionally we run into a person who is not, and that's when we would consider using the safety net.
So you showed the graph showing your revenue going down quite a bit next year as the staffing changes. Are you expecting it to level off thereafter?
Yes, it will level off. Oops, I goofed. So it is. So we're projecting it to be at about 134 million next year, and it will level off at that. But however, it could go up in that we could get one of those cost report settlements again. So, but that ICF, the loss of that $24 million from the ICF that passed through, that will never happen again, and so that will level off, as well as the fact that the loss in the provider revenue that we're losing.
And since your revenue and your expenses are going down, why isn't the percentage of money being used for waiver match going up?
That's a good question. I think that we are trying to direct more of our resources to enroll more people on waivers. So I can say this current year and next year, we're projected to enroll more people on waivers, new people, 300 or so new people, which is a lot in a year. And there's a work effort involved in that too. So we can't necessarily enroll that many more. We just might not be able to accomplish it. But it's something we should look at. Part of the reason that percentage fluctuates is from time to time the state participates more. So if you've seen, there's been a lawsuit, Ball versus DeWine, around people with developmental disabilities being able to access community services. And because of some of the pressure around that, the state in its budget, not this budget cycle, but last time, they invested a lot of money in making sure county boards were able to enroll more people on waivers. But then that doesn't show up as, that's not our contribution, that's a state-funded waiver. So the people, there are more people than ever before on waivers. But it's a good question that we should challenge ourselves to look at. Why can't we do even more?
Well, it would seem to me, since your total expenses have gone down and the percentage of expenditures being used for waivers has stayed about the same in the mid-40s, that would seem to imply that the amount of money being spent on waivers is reduced because it's still the same percentage. Is that correct?
Overall, the number is going up. I would have to take a look at what percentage then is are funded through the state mechanism as opposed to our levy mechanism.
Okay, it just doesn't seem to me to add up.
Oh, I can get you some more information.
Okay.
Councilman Jones.
Many of my questions have already been answered. But one, since our goal is to support and empower those to live with disabilities to live, work, and play in the community, do you have a faith-based partnership? Is that something that's been part of historically a part of what you do?
Nothing formal, no. But we are interested in doing more to help communities welcome people with developmental disabilities. We've had a number of initiatives recently, but I think as part of our new strategic plan starting next year, we really want to devote some staff to making those kinds of relationships and partnerships and perhaps formalizing that a little bit. So I think we would, if you have ideas about that, we would love to talk more about that, about where to start with something like that.
There's a church in my district that approached me just about that. They're starting a special needs ministry.
Okay.
And they were asking for guidance and support.
Okay.
So let's talk offline.
Sure. Okay. Wonderful. Thank you.
Okay, thank you.
I had a couple questions. On your slide, where you launched the CLE and the ATV,
Yes.
you talked about that mobile unit. Does Medicaid support the families with the cost for some of those?
For some things, yes, not necessarily for everything. But what we've encouraged people when they come and look at things, I mean, some of the things are very inexpensive and widely available on Amazon or at Home Depot. Some of them are really just everyday items that our assistive technology staff have figured out a clever usage for, so that we just would, show people to take a measuring cup and use it in this way instead. And so it's also things like that that are very affordable.
Oh, okay, because I was looking at ceiling mounted lift system
Yes.
that would.
Right, that would likely be, Medicaid would likely be involved in something like that. We also have a sit-to-stand wheelchair. I'm not sure that Medicaid would pay for that. It's very expensive. But we try to frame it in that this is a place to come and have spark some ideas, not necessarily that if you see it, you're going to be able to get it tomorrow.
And then the one cost settlement support that you used to receive, tell us a little bit about that.
So we have to file cost reports with the Ohio Department of Developmental Disabilities every year. And then after all 88 counties submit those, there's a settlement process. So there's always a long lag. That's how it is. And in the past, there would be a settling process every year. Sometimes counties have to pay money back. Sometimes we would receive additional revenue. But they wait until all counties are submitted and audited, so that before they make all those determinations. Apparently, within the last couple of years, they have indicated that they're going to go to an every other year settlement process.
But I thought you said that would go away, or just for this county, it's going to go away.
No, so this year we received $24 million in that. We won't be getting that next year. So that's part of why our revenue next year looks a lot lower than in this year. So we could get a settlement in the following year that might be, it probably isn't going to be $24 million, but it could be something. Eventually, that whole entire thing will go away because we're not a service provider any longer, and that's much of what we are reporting on in our cost report. There's another item that we report on called targeted case management for our support administration services. So that would continue to go through that process.
And for those funds, when you did receive them, you were able to use them in your general fund,
Yes.
whichever way you wanted to?
Yes.
No stipulations on that. I think everybody asked all the questions. Okay, especially about my displaced employees. So I remember in previous presentations you did when the state mandated by 2024
Right.
that you had talked about what you were going to do. What are some of the incentives that you're going to?
We created a wage, we called it the wage advancement, and so we looked at our staff who would likely want to continue to work, and we just created 4 tiers. And so for any of those individuals that go to work for one of those 2 private providers, we would provide a wage advancement to that provider so that they could pay those people either $14, $15, $16, or $17 an hour, which is more than their base rate.
And how is that sustained? Is that just a one-time?
It would be, well, we have a 3-year contract with the providers, so we will reevaluate that probably in the last year of the contract and see if we want to continue it or if our board would continue to support it after that point.
And you mentioned that your strategic plan will be discussed at your December meeting?
Yes.
Any other questions for the director?
No.
All right. Well, you always give a updated report. It's kind of like a little mini TV show that you give, because you always keep us updated, and we really appreciate that.
I appreciate your interest in allowing me the time to give you the updates. And I will follow up with you, Mr. Miller, with the waiver match percentage, and you, Mr. Jones, on the faith-based. Thank you
Okay.
very much.
Thank you.
Thank you. Any miscellaneous business from anyone? All right, hearing none, this meeting is adjourned.